Hi, hello everyone. I'm Jill Manthorpe and I work at King's College London, and I'm the Director of the Social Care Workforce Research Unit, which in January 2019 moves to become the Health and Social Care Workforce Research Unit, and that's a government funded unit based at the college.
Would you explain what you do to a layperson?
Yes. Well, like many people, you try and explain what you do, and sometimes it gets very complicated. So the way I might say it to somebody is that we hope to provide, mainly to the government, who are the main funders of our studies, information, advice, suggestions, and insights into the rather complex world of social care or long-term care in England, and sometimes we tell them what's happening in other countries as well.
Will you be speaking about England specifically or the UK today?
I think I'd rather speak about England because that's where we mainly work. But obviously, one of the interesting things of working in the UK at the moment is that we always keep a close eye on our neighbours in Scotland, Wales and Northern Ireland. And I'm really lucky in that sometimes I get to go there and to talk to people there. And so it's really helpful to take either a UK view, but particularly England, which is where we're interested in.
What would you say are currently the three main policy priorities for long-term care in England?
Well, as probably most people know, long-term care in England is often referred to as social care, and that's a big policy priority for the government at the moment, and it's a priority perhaps for three reasons. First of all, everybody is waking up to the fact that we're living in an ageing society, and that places great challenges but also opportunities on systems throughout government, but particularly those responsible for National Health Service. Secondly, we're also aware of other demographic changes, which mean that people with disabilities are living much longer, and so that too has challenges for social care. And then thirdly, there is a big problem in the way in which our health services are organised, and our hospitals in particular experience delays in being able to send people back home after hospital treatment, and sometimes that gets seen as the fault of social care. So in a sense, those are the priority areas of interest in parliamentarians, but also in local government in England today.
To what extent do you think these priorities have changed in the last 5 years, if at all?
Well, I think they have changed in many ways because part of the change has been that you can hardly turn on the television at the moment, and particularly the news, and not see something that isn't a social care problem. So even today, in the middle of December, last night on the BBC, there was a play about social care, the caring of a mother who'd had a stroke by a single parent daughter. It was a play about social care. So I think one big change in the last 5 years is that most people now, when they hear social care, have a vague idea what that means, and some of them know very well because their own families are involved in it. So I think that's the first change. The second is that there have been quite a number of political promises that what is often described as the social care crisis, or the mess that social care is in, or the uncertainties, has reached such a point that something needs to be done. And so at the moment the English government is just about to produce a green paper, that's a discussion paper on adult social care, and we all look forward to that being released in the near future, but that may be January.
So if you had the opportunity to introduce one new long-term care policy in England, what would it be and why?
Well, the danger of asking somebody who's spending quite a lot of time thinking about this is that you get quite a complicated answer. So of course, if I had a magic wand, or in England, as we say, a magic money tree, my policy would be to change the funding system so that the magic money tree appeared, and that everything, quality was raised, inequalities diminished, and we would all live happily ever after. If you ask me a real life question, I suppose what I'd say is that I'm increasingly concerned that many things now are taking place outside a regulatory framework. So that means that there isn't much inspection or regulation of care being provided to some very, very vulnerable people, often in very distressing circumstances. So the particular policy change I would make, and of course this is my personal opinion, not my funders, is that I would do something about housing provision, which in a sense provides an enormous amount of social care. In England we call this supported housing, and it's here I think where we're really not knowing what's going on. Quite a lot of money is being spent on it, and some very vulnerable people who've got nobody to argue for them are living in these circumstances, and I think they need the fresh air of monitoring, regulation, inspection, which I know has bureaucracy, but I think it's worth it to have some scrutiny of this particular area.
In terms of research priorities, what do you think is an outstanding piece of research on long-term care that needs to take place in England?
Yes. Again, that's awfully difficult when you ask somebody who's really working on research questions day and night. So I'm afraid I'm going to give quite a technical answer here, and that is to say that in England we have some really good data. We collect data about people's experiences, which is really good, not just quantitative or clinical measures, but as well as having a lot of data, we don't always join it up. So my plea would be for research to better understand how we can make good use of the data that we collect. People put a lot of time into this data, and then if we did collect it, to think what we were going to do about it. I think it wastes a lot of people's time not being able to join data sets together, as they say, and we don't really get a rounded picture of people. So, for example, if you're an individual living in a care home in this country, there will be data from the NHS, but it won't really join together with data in relation to your funding or data in relation to local government or public health. So I think that's my research agenda, is how to work with people so that the data can sing together in a chorus rather than to be very separate parts of a musical instrument.
So now I'm going to ask you a few quick questions. I'm looking for a number in response from 1 to 10, where 1 is low and 10 is high. So what policy priority is allocated to long-term care in England?
Well, again, the closer you get to the subject, you're always saying in which part of the policy process and in whether or not something is more rhetorical than is real. So I would say that at the moment I think it's about 6.
How aware is the general public in England of what the long-term care system offers to them?
Again, we know about the general public that you're usually only interested in things when they begin to loom on your horizon. So at the moment, I have very little interest in primary schools. I haven't got young children. If I don't see them, when you walk down a street and you see things, don't you? And I just don't see schools. So I think talking about the general public is difficult. But I think as you approach later life, your parents approach later life, you've got members of your family who in later life or have got disabilities, then you suddenly become aware that the system doesn't work like the National Health Service, in that there's pretty universal coverage and that there will be eligibility criteria and financial thresholds. So saying that in terms of the general public, I'd probably put the general public around about 3, but I also would say that that might apply to something like primary schools or libraries. What you're interested in is what you're interested in.
How well does the system support people with long-term care needs?
Again, that's a difficult question, isn't it? And I think sometimes those of us working in research tend to see the glass as very half empty. And interestingly enough, when we stand back from the data, we perhaps are sometimes surprised. The results of the adult care, social care survey are very good, that most people receiving care think very highly of the people that deliver it. Yes, there are aggravations in the system, but when we are looking at, as researchers, we often find faults with things, don't we, about things could be better. When we ask the people receiving social care, they're generally very, very pleased with it, and I think again, the public might not be so pleased with it because we see the dramas on television, but in terms of service users, I should imagine it's probably about 7.
How well does the system support the needs of carers?
Again, difficult to say. First of all, in England, I think we need to be proud of what we have offered carers, which is world leading. England was the case. It was the place where carers have been recognised, both in terms of public policy and in terms of law. So that's great for us. We have, while they may not have much teeth, we do have strategies and action plans, and very few politicians would miss the opportunity not to praise carers, partly because they're so many of their voters and constituents. Having said that, the offer to carers is nowadays not very much, because really people often have to wait until crisis point is reached, and I think we hear that from carers, such as in the BBC drama that was on television recently. So probably in relation to carers, I'd say it was 5.
Finally, how integrated are social care and healthcare services in England?
Well, in many ways, I don't want health and social care to be integrated. I would like social care, particularly social work, to have an independent view from clinicians. I think the joy of something like the multidisciplinary team is that you have a variety of perspectives, otherwise everybody's just a clone. So I think the rhetoric of integration is something to be very careful about. What we're talking essentially is about being able to share data, which is quite difficult in this country, between services. What we're also talking about is the ways in which people don't have to repeat the story time and time again, which often is a matter of data sharing. And we also want to reduce some of the inequalities between people who work for various professions and have received a lot of training and a lot of support, and some people who receive very little and have not always had very many advantages in education or other circumstances. So integration is an easy word to say, isn't it? And we always need to think about what would we like integrated with whom. You cannot date too many people at one moment. So in many ways, I'm interested in integration, but think we have to be much more circumspect about it. And probably I'd like to see it more as a verb than a noun.
Thank you so much for your time, Jill.
Thank you. It's been a pleasure.